Hello, hello, welcome. Good afternoon, everybody. Good afternoon. I'm super excited. Yes, people are joining us. Thank you for those of us who have kept a date with us, like really timely coming in to the broadcast. This is Africa Rise with Susan West. Africa Rise is a platform that we have designed to inform, educate, entertain, bring more insight on relevant issues concerning Africans on the continent and in the diaspora. And of course, today I will be joined by Professor Edagwa. Professor Edagwa is an assistant professor at the University of Nebraska. And also, Dr. Paul Ohi, a lot of us, of course, know who Dr. Paul Ohi is. If you don't know, Dr. Paul Ohi was the former Director General of NAFDAC in Nigeria. Without taking much of your time, I'm going to be introducing first Dr. Paul Ohi. Have been having issues connecting to the broadcast. He's currently in Nigeria, and we've been battling with getting him online. And so for now, we're just going to go ahead with the broadcast and bring on Professor Edagwa.
Thanks, Susan, and hi, everyone.
Hello, Professor Edagwa. It's such a pleasure talking to you. And I just want to start by thanking you for taking out time from your busy schedule to join us on the program. And it shows how much love and regard you have for us on the continent and in the diaspora generally. I have just done a little bit of an introduction of who you are, but I just would like for you to just take a few minutes and tell us about yourself and what you do.
Yes, so my name is Benson Edagwa. I'm an assistant professor at the University of Nebraska Medical Center. I earned my undergraduate education in Kenya, a small country in Africa, East Africa. Then after I earned my undergraduate in chemistry, I came to the US for my PhD degree right after my undergraduate. So I earned my PhD in medicinal chemistry. Then after earning that PhD in medicinal chemistry, I came down from the south of the US, which is Louisiana, to the Midwest, where I'm currently working as a postdoctoral fellow. Then I have risen through the ranks to become a faculty member in the Department of Pharmacology and Experimental Neuroscience. So what I do with my chemistry background is I work together with a team of other scientists who have complementary backgrounds to mine. And what we do for the most part is trying to come up with better ways of treating and preventing chronic illnesses like HIV, hepatitis B, tuberculosis, and many others that we will talk about. And then I also have a team of graduate students who work under me and also postdoctoral fellows. So I'm not only engaged in research, I'm also engaged in training future scientists.
Oh, wow. And Doctor, if you don't mind, Professor, you look so young and you've achieved so much in such a short time. Congratulations on your new. There is a vaccine that brought you to my attention, particularly, and the rest of the world. And it's a vaccine that you and your colleagues have come up with to help help HIV and AIDS sufferers, who have to take medications on hourly basis in the space of 24 hours or on a daily basis. And this vaccine you have come up with is something that they need to administer just once a year. Could you please just talk a bit on that?
Yes, so before I talk about this specific medicine, I would like to say that we've also done, or we are also working on ways of achieving a permanent cure of HIV. And if you've been paying attention to our work, sometimes last July, we came up with an approach that we call a combination of gene editing and these effective medicines to not only suppress how the virus multiplies in our bodies, but we were also able to go after that portion of the virus that lives within the human DNA. Because, that's the biggest hurdle we have with HIV. It's a very smart virus. When it gets into the cells, it makes its way into the DNA. And anything that becomes part of the human genetic material, DNA, it means the human lives with that condition for the entire lifetime. So the only way you can remove, or the only way you can treat such a condition or disease is by going after that portion that is sitting right in the DNA. And that is what we exactly did with what we call molecular scissors or gene editing. So how we did this, we went after the active form of the virus. And then after that, we went in with the molecular scissors to cut out the portion that was sitting in the human genetic material or DNA. Now, we still haven't tested that approach in humans because, there are ethical ways that we do science here. Now, what about this medicine that could function as a vaccine? I can say this medicine is not a vaccine as such, because when you think about a vaccine, biological vaccine, vaccines are supposed to go and train the human, immune system to learn how to fight off an infection when exposed to. Yes, but this medicine does the job. And how it does the job is, once you give such a medicine to an infected person or someone who is at risk of getting infection, what it does, it blocks the virus from getting into the human DNA. So it's taken us around close to 5 years to get where we are. And we are not yet there. We're still moving forward. But I know these are things that we will discuss. So many things inspired this kind of approach because we know that if you can give medicines, HIV medicines, to those that are at risk of acquiring this infection or this dangerous disease, there are so many studies that have shown that those medicines are very effective if taken as prescribed by the doctor or physician.
Right.
So, but people have always their own way of doing things. I know we see this a lot in our daily lives. Sometimes you take a medicine and you somehow feel better, and then you say, you know what, I will stop taking this medicine. So when it comes to HIV, when you do that, the virus does what we call mutations. So once the virus gets into a form that we call a mutated version or evolution, then that medicine that was once effective or useful, it becomes useless. Right. So some of the questions we asked was, how do we make these effective medicines better? How do we take off the burden from those that are using those medicines? That way they don't have to carry those medicines around themselves. How do we just keep it in the body? That way the body can control, the body's enzymes or biological proteins can control how much gets into the blood for an extended duration of time. That way we can have an effective drug levels for up to a year to protect people from becoming sick. So that is how we got where we are. And I'll be happy to go into the details depending on the questions that you or other people that are joining us would have.
Yes, of course. Thank you, Doctor. Thank you. Of course, I can call you Doctor. You're a PhD after all.
Yes, that's true.
Right. So, it's interesting to know that it took 5 years to get to this point. There's a WHO findings that states that 73% of the global deaths each year from HIV/AIDS are in Africa. Like 73% of the people who die from this disease are in Africa. And it's only because of the lack of access to reliable medicines and treatments. So I want to know this discovery, this vaccine, is it something that is already available in use in the US, for instance?
So I want to be clear that there is no HIV medicine that could be given at intervals of once every year. This is going to be the one of its kind. But of course, we modified an existing drug that has been shown to be safe and effective. So that is what kind of puts us ahead of the curve, because we are working with a drug that is known to be safe and effective. But however, there is a version of this medicine that could be given once every month that is currently approved for use in Canada. So Canadians are already having benefits of once every month, treatments. But that is not enough. The question we asked, can we do better than that? So that is how we came up with this once every year, because of the excitement we've seen and the kind of the acceptance level. Many people want to have medicines that can last in their system for a long time to protect them. So that kind of level of enthusiasm or excitement or acceptance actually is the one that pushed us to get to this level. Now, are these medicines going to be available in Africa anytime soon? I don't have a clear answer to that, but that is something that we are currently thinking about because, myself, I come from Africa. I have seen firsthand, how those patients suffer. And it's very sad that we still have, some of those old medicines being used in some places in Africa. But all I can say on the positive side, we also have some of the newest effective medicines beginning to make their way into the African continent. And one such good example is a drug we call dolutegravir, which belongs to a class of HIV medicines called integrase inhibitors. It's the same class of drug that, like the one we are currently working on. So it works by blocking the virus from becoming part of the human DNA. So we luckily have that medicine in places like Kenya and South Africa. I'm not sure about other places in Africa. But the way I do my science, I try to also connect myself to the reality. I try to look, is it just enough to design or make changes to treatments that will only benefit specific populations and ignore or sideline those that are heavily affected by these diseases? So that is how I actually designed something to be useful or to be helpful to the African continent. And as we speak, we actually have another long-acting dolutegravir, which will be reported soon, and it has just similar features to the one that was recently reported. So you see, when you start applying such effective approaches and technologies to medicines that are currently used in places like Africa, it means you're also making it possible for those people or those populations to have access. Because we live in a small world. If we just focus on a specific portion of the part of the world and ignore other populations, people move around. And when people move around, they spread these viruses. So for us to be able to defeat this virus and many other viruses, we have to make sure that we get the medicines to those that need them the most. And that is what we are trying to do right now.
Absolutely. Absolutely. That brings me, I was supposed to have Dr. Paul Ohi on the program. There are certain questions that I would have directed to him, but I think you can actually do a little bit of justice to some of the questions I will have. That brings me to, asking certain questions like, you're doing all this marvelous work in the United States of America. There are loads of your kind, Africans who are in the diaspora doing excellent work. Also on the continent, the challenge is on the continent, there is a challenge of, funds, so they're unable to, you know, research on diseases that are unique to Black people or to Africans. And so we rely on your people like you who are trained and working in foreign countries and organizations. In 2005, there was a research that was carried out by the World Bank. And the research identified South Africa, Kenya, Nigeria, and Zimbabwe as having the industrial capacity that can be made available to produce medicines and vaccines for exports, and of course for domestic consumption. But Africa's story seems to be always wrapped around discussions and findings and potential. And so for me, this program is about discussing, throwing more light into insights and educating us Africans on how we can, move the continent forward. I mean, since 2005, such a research was carried out, and up until now, we cannot boast of a country on the continent that has got to the point of producing medicines and vaccines, at least for local consumption. So, in your experience, what would you say is the way forward?
I think we, as Africans, we really do a good job when it comes to planning and talking. That's what I can say. I know we have the resources to do this work and to get the work done. But sometimes I would say, for the most part, we really don't know how to prioritize things. Sometimes we focus too much on what we don't have and forget what we can do and what we have. And I would say the continent just needs to look at, how other Africans are doing in other countries. African has they have some of the smartest people around the world because, we all were created with the same mind, with the same thing, same way of thinking. And we can just do what other people are doing elsewhere in the world. So the questions that we need to ask ourselves, what are we doing? What are our governments doing to ensure that, those ideas that people have move forward? That is what we need to where we need to start, governance and leadership. And then also the question that, our own African scientists need to ask themselves, what kind of mechanisms are they going to put in place to ensure that when they come to, the ordinary people in the villages and tell them that this is what we are planning to do, what mechanisms are they to put in place to ensure accountability? Because, that is what has made many research institutions succeed in other places like the US, because, we have very good functioning funding agencies like the National Institute of Health. And, when we get those funds to do the work, we don't deviate from what we said we were going to do. Of course, you can change the approach, but you have to stick to the goal. And that is where we go wrong. Sometimes we come up with we change goals instead of changing the approach, the way we are doing things. So we need to have those accountability mechanisms. We need to have full government support. That way, ordinary citizens and government agencies can go to the scientists and ask them, okay, we gave you this money to do this work. What have you done? There has to be transparency, and that is where it needs to start. So it should not just be one way, as a scientist blaming the government for the things that they are not doing for us. We need to go to them with the plans, tell them that this is what we are planning to do, and these are mechanisms that we are going to put in place to ensure that we do the things that we are proposing to do. And I think everyone will be convinced and they will see the value for their investment. And then that is how we are going to come up with the problems that affect us, because many places in the world tend to focus on issues that affect them directly. It's like you and I, if I'm hungry and you're not hungry, I will come from my desk and maybe go to my house and make myself a meal, or go to a restaurant. But me going to the restaurant and making or selecting a certain meal, or going to my house and making a meal, that doesn't mean that you should do the same thing because you are not hungry yourself. So we have our own problems that are very unique to us. But we have our own solution. We need to create our own solutions. And there are better mechanisms that we need to put in place to implement some of those plans that we put on paper. So it's very kind of disappointing that, we sit in boardrooms, we come up with these big ideas, but none of those ideas see the light of the day. But I'm very happy that, if we don't get the support that we need at home, we are able to still do the science that we can do elsewhere. And that is why some of us are here doing the science, but it's not like we don't like to work at home. We are trying to use the talents that, God has given us to improve, how people live in the society. And some of these solutions that we are coming up with are not only going to benefit people living in the developed world, they're also going to benefit those in resource-limited settings like Africa.
Right. Absolutely, I agree with you. And unfortunately, it's not as easy as ABC back home for your colleagues back home in Africa to, access funds, and unless, of course, the will is strong from the part of the government. Then, for instance, I want to ask you, this HIV/AIDS vaccine, once a year vaccine you have come up with, how do you think is this something you've thought about using against the coronavirus? Of course, we're in the in the age where it's all about the COVID-19, and so I mean, a lot of people will be, blown out of their seats hearing that such a drug is already available, or a vaccine is already available.
Yes, so the good news about this coronavirus, we've learned so much since the outbreak, that occurred in China in 2019. It's good that we now know how this virus infects, the human cells or the human body, and how it multiplies and what kind of harm it does to the body. Earlier on, we used to think that this virus targets the lungs. We used to look at it as a respiratory, or it affects the breathing pattern. But now it's coming clear that, it's affecting other organs like the brain, the heart, the kidneys, the liver in the body. So the way we are trying to approach this is we are looking at both vaccines and what we call repurposing of known medicines that have been shown to be effective against other viruses, to see how we can engineer them to target this specific virus. Now, is the drug that we reported last month going to be effective against COVID-19? There is no proof. Why? Because, with the coronavirus, that virus doesn't become part of the human DNA. And, the way the drug that we reported last month was designed was to block that step that enables the virus to get into the human DNA. So that is what makes such a drug not that effective when it comes to coronavirus. But we know how this coronavirus, how it affects the cells, what supports its life. And we are currently, as we speak, actually, I am actually at work. We've been looking at different medicines, and we trying to identify medicines that would rapidly be used in the clinic. And how we are looking at those medicines as, people continue to look for vaccines, we are looking at therapies that would not only help those that are sick, but we are also keeping in mind that, we've learned these skills, or we have this knowledge from HIV prevention therapies, those that can last for a year. Can we identify a medicine that is effective against coronavirus and put in the same features to protect people for a period of 1 year, just like the way we do with the flu vaccines? So we are already working on that, and we've identified some few candidates, and we hope that, we'll be able to move that forward. And then, of course, by the time we have people put on such medicines, hopefully we'll have a vaccine that will give us some kind of permanent defense mechanism that we will be able to live with this virus. But all I can say is people should just follow the guidelines that the various healthcare professionals are giving us and government agencies. Let us follow those simple guidelines. This virus soon will be a history.
Thank you. You know, the funny thing is, as ordinary people, there's so much conflicting information coming from authorities, that we expect that should know so much. Unfortunately, this virus has caught everyone unawares, and so it's exposed a lot of weaknesses in even the governing bodies of the world that are supposed to know. We used to look at just wait to hear from the WHO, and then whenever they say it's a final say. But it's not the case now. I just want to bring to your attention, though, that some of your colleagues on the continent who have been at loggerheads with their governments because they claim that there are certain malaria medicines that they have known to be effective against the COVID-19, and no one seemed to be listening. The reason we're not listening because the WHO haven't lent their voice to supporting that claim. Also, there is this COVID CVO herbal mixture from Madagascar that is making the waves. As an African, I'm not sure if you know about it. I mean, if Madagascar has made this claim and they haven't reported deaths, don't you think, in your opinion, don't you think that the Madagascar herbal concoction, I don't know what to call it, be something that should be given given an opportunity basically for the rest of the populace to try, not just in Madagascar but the rest of Africa?
Yes, I think there is nothing wrong in using herbal medicines, but I think we need to ask specific questions as we develop these medicines. The goal or the purpose of creating a drug or a medicine is to save lives. You don't want to create a medicine that will create more problems. So let's now start with this medicine that is currently being touted by authorities in Madagascar. What they need to do, there has to be some sort of planned trial that will show for sure this drug is, or this herbal medicine is working. There is no doubt it may work. It could be working. But the questions that these people are not really trying to address while they put people in these concoctions or these medicines, or these herbal medicines, is what are they doing to minimize resistance or the development of resistance of other conditions like malaria, where such a concoction is being used. Because if you pay keen attention to that plant, it has a compound, a molecule called artemisinin. That artemisinin is very effective. It's known to be very potent or very effective against malaria. In fact, it's very stronger than things like quinine or quinine. So, and the way some of these antimalarials are designed, they put in some of those ingredients from that plant so that we don't have people developing drug-resistant malaria. Now, when you expose people to a drug or an important medicine that has been shown to be helping a larger population of people, through trial and error, and in the process of doing those trial and errors, there is that, in the area of the drug discovery, there is that portion of there is that phase that we call a subtherapeutic level of drug in the blood or in the system. Subtherapeutic means, yes, you do have some drug in your body, but that drug is not enough to kill the pathogen or the disease-causing organism that you're trying to target. So when you expose such limited or small amounts of drugs to pathogens, what they do what we call develop resistance. They evolve, they change shapes so that they can become resistant to that drug. Now, looking at the scenario, let's say malaria in the tropics, like place in Africa, it kills millions of people in Africa. Now, you have people experimenting with this artemisinin, or this extract that has artemisinin on people, and then they put in populations, and then you have reached at a point where the same people are exposed to malaria when the drug has already dropped below what is required to protect them from malaria. Then you'll start developing strains of malaria that are very resistant to artemisinin, and that will cause more deaths in the future. So we are looking at the future, we are looking at what the future ramifications, future kind of, bad things that could happen in the future. So that is what people or scientists that come from such societies, these are things that they need to sit down with these government officials and tell them, yes, it's working, but how do we come up with a plan or a clear plan that will not compromise other uses of this drug? And the other thing that they don't really pay attention to is how much of the drug is given to specific age groups, because the drug that is given to me or you is not the same amount of drug that should be given to a child. So how do we address that? So those are missing gaps, and that is why you see agencies like WHO, they are kind of hesitant to jump onto such interventions, even though they know that there could be some promising or light at the end of the tunnel, but they're processing all that information. So it is a very complex process that I think scientists need to sit down with those government agencies and try to tell them that this is how it needs to be done, and this is what we need to do to ensure that we don't compromise diseases or other conditions where this medicine has been shown to be effective, because nobody really pays attention to making medicines for conditions that affect, places like Africa, let's say like things like malaria. Nobody really pays attention to making newer drugs against malaria. So we really have to be cautious moving forward. And when you think about things like chloroquine or hydroxychloroquine, there has to be a way that, we really need to understand how does this drug work. And it's not just about the drug working. We need to know what other bad things can this drug or medicine do to the body. So there has to be a balance. There are several studies that have shown that things like hydroxychloroquine, they are not good for some people. So we need to identify those people that are good with hydroxychloroquine and other, of course, medicines, and those that are not, and make that clear distinction so that when you're placing people on these trial medicines, we are not creating more problems. And that is what many people don't understand. They just, say things like, the WHO is trying to block anything that is coming out of Africa. But I think what we need to know is, yes, Africa has many, many herbal medicines, and many of the medicines that we use in the modern world are actually borrowed from herbal medicines. Sometimes we do refinements and we make them in the lab to simplify, because again, we cannot just rely on nature. But we also have to be very smart when we are trying to recommend some of these interventions to the society.
Right. Absolutely. Prof, I just wanted to ask, you went from Kenya and you went to the US and you advanced your studies, and look at where you are. I can't remember if it's Tanzania or Zimbabwe that tried to have a facility where medicines were supposed to be produced on the continent a few years ago. And one of the issues was that even though it was situated in Dhaka, it was 90% of the manpower were foreign from India and so on. It's I was shocked to find out that with all the pharmacists that universities, at least from Nigeria where I come from, produce every year, that manpower expertise is a challenge on the continent. How do you think, in your experience, that we can, develop our citizens in Africa to take on these responsibilities?
I think what we need to do again, much of that burden rests with our governments or with our leaderships. That is in my opinion. I think what needs to be done is when we are encouraging some of these investors, foreign investors to come and, start some of these companies in our own societies, we should not just look at, a portion of the package. We should really try to dissect the entire package so that we put in requirements like, there has to be this training that is supposed to be passed on to our people or to our societies. That way, we are also, ensuring that that knowledge is also being passed to our societies. It should not just be a focus on money. They are going to pay taxes or things like that. We should look at long-term investment, and we need to set those targets or those goals in those agreements so that if we have a company that is going to set up or a foreign or whatever company, be it myself or anyone that is coming to an African that are trying to set up a company somewhere in Africa, there has to be a plan to include things like what is your plan for training those in the society or those that could, move such technologies forward. Of course, companies have their own interest because, there is what we call patents or other things, trying to protect the inventions because, there's just so much that goes into these discoveries. And many companies will try to recover what they invested in these discoveries. But of what needs to really come out is how do they give back to the society through training? Can they support the local institutions? Because, we have local colleges like universities in Africa that offer programs. Yes, they offer those programs at graduate levels, but if you look at those graduate level programs, they're mostly theoretical, things that they read from textbooks. So what we need to ask is, we have this company that wants to start something in manufacturing. How much are they going to or willing to invest in a local institution in terms of building a lab and giving things like internships to students from such local institutions so that we can become self-reliable? That is the only way we can overcome some of these challenges, looking at the package entirely, not just, what we are going to get in terms of buildings and taxes, because those buildings can be shut anytime because, companies have moving targets and goals. And, when you have a society that is trained, you cannot say that is going to change. It's like myself. I cannot change myself. I'm an African and I'm very proud to be African. Nobody can change that. No matter what, I'm still an African.
Absolutely. Absolutely. One of the things we know is, of course, one of the challenges, of course, Africa suffers is also that there are diseases that are unique to Black people. For instance, um, white women don't suffer from fibroid. you know,
Yes.
for instance, the sickle cell anemia, it's a Black disease. White people don't really, I can't remember reading anywhere that a white person. So if we're able to encourage research and encourage your colleagues on the continent to get well, somehow get through to the government to make funding available and get them to work on it. Then we can begin to solve our own issues because I don't see how the West will take on issues of Africa that don't really bother them and make it a priority as to wanting to study how to eliminate malaria, eliminate sickle cell anemia, and so on and so forth. Just out of interest, a lot of people are super scared on the continent. There is a lot of trust, lack of trust with the certain systems, and people are suspicious of vaccines now. Well, they always have been, but the situation is so heightened at this point. From your point of view, what would you say to Africans around the world, especially on the continent, as regards whatever vaccines they might be working on to treat COVID-19? because there's a lot of suspicion, a lot of talks going on about sterilizing people with vaccines, and so people don't have that trust. People are scared. I am scared too when I hear these sort of things. From your focal points, what would you say to
Yeah,
us?
I would say, you asked a very complex question. So the first portion of the question that says that, talks about the West not having to care so much about the diseases that affect our populations. I think they are doing their part, but they cannot do everything. Like look at
Absolutely.
HIV or other global conditions. We live in a global world. I was born in Africa. I'm here. Africa is still my home. So if they are not able, they are not able to address conditions that affect people in Africa, somehow those diseases will get here. And they are doing their part, but they cannot do everything. I can tell you for sure. Agencies like the National Institute of Health, I know they fund several foreign institutions to do research. But the problem sometimes we face is, shifting our goals. But if we can address that part and accountability, I think it should be fine. Now, when it comes to vaccines, sometimes it's very sad what we see in the media. People targeting some individuals and saying that so and so has this vested interest in this vaccine development because they want to make money. That is not how we should look at things. We need to be aware that we live in an era of fake news, and actually everyone is trying their best to ensure that people live in a safe and in a safe environment. So when you see people targeting certain individuals in the society, saying that they are doing this because they already had a vaccine for this condition, that is a total lie. Like there was that rumor that was going around that COVID-19 was made in the lab, and people already had a vaccine and they already had a patent. That is false. There are so many coronaviruses that have been around for ages. So there is so much false information out there, and people have to be very smart. We know if a vaccine is made and shown to be safe and effective, they do work. And it's the best way of protecting ourselves. Just like the way we take, multivitamins to boost our own immune systems. So we need to train our own immune systems to learn how to fight some of these conditions. And that is how vaccines become important. But the most important thing is for these vaccines to be sure to be effective and safe. If they're not safe and effective, they will never get approved and they should never be used in humans. That is why when they are designing some of these clinical trial for vaccines, they start by a small group of individuals so that they can look at the safety profile of the vaccine before they start looking at things like effectiveness. And that is why you hear things like a vaccine takes like 18 years to develop. Look at HIV, for example. We've lived with HIV for 40 years, yet we don't have a biological vaccine against HIV. Now, if someone somewhere had an ill motive, they would have run around the continent of Africa and say things like, we now have a vaccine for HIV, a biological vaccine for HIV. Let us give to this population so that bad things can happen to them. Why would they wait for COVID-19 that is affecting everyone around the world? So people really have to be very smart, and they really have to digest some of this information, because some of these statements that we are beginning to hear are so much linked to political statements or political alignments. And we also have to be aware that the US will be having an election very soon. So depending on who supports who, propagandas are going to be built around such affiliations. So we really have to be smart. We have to kind of make a clear line between science that is supported by evidence and rumors that are just supported by people like that want to bring down others and reverse the gains that have been shown for many years. Think about things like polio. Polio used to cripple so many people in the society in the past. It's a viral infection. But now we have an effective polio vaccine that is helping so many people around the world. So we need to look at some of those positives and be able to convince ourselves that, okay, vaccines development is a risky thing, but there is also this positive side that if the process of developing those vaccines is rigorous enough to identify something that is safe and effective, we are all going to benefit from this. So sometimes I feel very sad when I see people spreading around falsehood without really questioning the source of information or without trying to go deep to understand the accuracy of that information. And it's very unfortunate that many people like to believe in lies. But myself as a scientist, I like to see the data, the evidence to be able to determine whether whatever somebody is presenting to me makes sense or not. So that is how we do science.
Right. That is for you scientists. Well, would you say that the fears that people have, especially on the continent of Africa, is unfounded? Knowing that with experience of the past of vaccines, there have been people who can testify to the side effects of certain vaccines that have been used on the continent.
I think they're justified to have those fears because of what they hear. But we need to have government agencies doing their job. They need to ensure that those vaccines are safe and effective. So that is what we need to do. But we also need to keep in mind that there are those unscrupulous people that are trying to take advantage of this scenario to make money. So that is why people are kind of, they have those fears. Those fears are justified. But what we need to do is put our governments to task so that those fears can be allayed, because, that is their job. So fears
Absolutely.
are justified, but again, it's upon the government agencies and watchdogs to make sure that, they verify and make sure that what is being passed on to people is something that is not going to make it worse, but rather, to try to solve the problem. It's like right now you have so many people coming up with things like, someone just waking up saying they have a sanitizer, and then you hear people say that these sanitizers have effects. So people try to do crazy things when you don't have control mechanisms. And those such people exist. And people also have their own motives. Someone will come to you and tell you that this vaccine or this thing is not good for you, but I have this other thing that may work better than a vaccine. You need to ask that person, what interests do you have in this other thing? Because they could be having some other underlying or vested interests in doing their business. So we live in a marketing world, and we live in a world that we have so much information. But what will really save us from this mess is having the right decision makers and people to help us process some of this information with the help of governments, so that we can take the right decisions and we don't expose our societies to conditions that will make things worse.
Right, absolutely. Thank you. Another thing I wanted to ask is, for instance, I can read some of the comments. If there's Helen D, who is saying, but we want it to be safe. She's referring to the vaccine. And she also says, I'm not started in Africa. There's been this fear after the broadcast of those your French colleagues suggesting that vaccines should be tried on Africans first. Do you have any concern? And having in mind that it's taking 5 years to come to this point of coming up with a once a year vaccine for HIV/AIDS, we understand that it takes a very long time to come up with a vaccine that is safe. So would you have any concern if a vaccine comes up within the next 12 months or 18 months and they might have to test it on the continent of Africa first? Would you have any concerns?
I think vaccine development, as I said, it takes place in stages. And I would say there has to be ethical, that process has to be done in an ethical way. Nobody should just come to Africans and tell them that, we want to test these vaccines on you. That is very wrong. because vaccine development is a major risk, because some vaccines are developed from weakened portions of the viruses, and they could go either way. They could either make it worse or they could become effective. So when you're testing such a treatment on people, you are taking a big risk. So I would say when it comes to other stages of vaccine development, the risk has to be spread around the world, and it has to be tested on a small group of people that give consent or they accept to take that risk. Then when that risk has been kind of, taken care of, or when it has been clearly been shown that there are no risks to this, then we move to the phase of looking at the effectiveness. So there are several phases in this. Just like what we do in other processes like drug development. And that is where I say many of our governments fail us. Why do I say they fail us? Because when you have some people coming there to say they want to test some of these medicines or some of these vaccines, there has to be an agreement that in case this succeeds, how is my society going to, or how is this country or my continent going to benefit from this? Now we see many effective medicines, they are kind of, they are tried in Africa, they turn to be safe, very effective, but then after the trials, people are no longer able to access these medicines for free. They have to pay heavily. So those are things that our governments in Africa need to ask, those that are coming to do these trials in Africa, how are we going to benefit from this? When you create these vaccines or when you test these medicines, are you going to ensure that we have a stable supply of these medicines or vaccines at affordable cost? So those are some of the exchange things that need to be sneaked into those agreements so that we don't end up, just being used to evaluate or play critical processes in the in drug development or vaccine development. Then in the long run, we don't end up benefiting from that until those things become maybe off patent, or until organizations like WHO that jump in and say, okay, we have to subsidize these things so that people can afford them. So vaccines are fine. They've been shown to be safe, but just with like any other, drug development process, the initial stages are very, very kind of, it's a risky, because, they can either be effective or not. That's why we say they take time. Now, someone coming to me like telling me that they've done a vaccine development in 2 months or 3 months or 4 months, there will be so many questions that they will not have answered in that vaccine, because, determining the effectiveness or the safetiness of a vaccine is as important as looking at the effectiveness. You can have an effective vaccine, but if it's not been safe or has not been shown to be safe, then it's a useless vaccine. And if you end up putting such a vaccine in humans, it will cause more harm than good. So, and there is actually a defined period that people have to demonstrate that, this vaccine or this medicine is safe before they start doing those effectiveness studies. And that is why we say scientists will always have their own timelines, but of course, politicians will always have their own timelines to try to make things move fast. But in the process of making things move faster, we end up with such big mess. So it's a process, and it's a lengthy process. And I would say we have people at each level to look at different attributes of those medicines or vaccines to make sure that they are safe and also effective. And also the ones that you hear about, there is a vaccine being developed in this part of the world. Those are just clinical trials. They are not being approved for use. When it comes to approval, there will be some kind of thorough review that will look at different components of that vaccine before it gets the green light for use in humans.
Right. So we're also hearing our time is fast spent, but we have a few more minutes before we call it a day. Thank you for your time, but you're not going off yet. Thank you for covering for Dr. Paul Ohi, who should have been here to answer a lot of our questions that we are not going to ask today. But I'm just going to read what one of the viewers have asked. Aisha Suleiman says, how long shall we stay at home before the vaccine is out, and how sure are we it's going to work?
I
I'm sure you
think
answers to that question because you're not a government official, but you can do something about, you can say, you can just
yeah,
respond.
when it comes to deciding when lockdowns end, there are two scenarios. We can either wait for a vaccine to come out, or this kind of pressures, people being in the lockdown without food, such pressures will make people to come out. And any of those two ways could end up, could either work so well or could work in a very terrible way. So what we need to do is, I would say, let us be patient. There are many other drugs that are being repurposed right now. There are many other interventions that have been identified, like what we call convalescent plasma that is being collected from those that have already recovered from infection. We need to see if we can use such interventions to protect those that have not been exposed to this disease. But I think what governments should be doing to accelerate, some of these, really kind of relaxation of some of these lockdown measures, they need to roll out testing of not only those that are infected, they also need to start testing what we call antibody levels or markers in the blood to determine if one has already been exposed or not. Because we know that many people around the world have already been exposed without having known that they've been exposed. So we need to accelerate those tests, and that is what is going to bring back the economy back to normal, even before we have a vaccine. Because, if we do enough tests to determine those are sick, we'll be able to isolate those that are sick. If we do enough tests to determine those that have already recovered, we can be able to get their plasma and use it for, to treat other people, or we can allow those populations to go back to work. So having those mechanisms will help things get back to normal than just sitting and waiting for a vaccine. Because as I said, there is no guarantee that any vaccine process is going to give you a positive outcome. It's a gamble. So we need to have that reality. But there are things that we can do at the moment to get people back to work and back to normal life.
Right. And to my last question, real quickly, because we know that it's a gamble taking a vaccine.
Yes.
I think it's the reason why, one of the reasons why people are scared when they hear that it's going to be a compulsory thing. We're not sure. These are all things we're hearing in the marketplaces, so to speak, in public places. So, what would you say to us who are so not wanting to buy into the idea that people should be forced
I would say,
to take the vaccine?
yeah, that's a very good question. I would say you have two choices. There's a clear choice, there is a clear direction that shows, if you don't get this vaccine, you'll either get the disease, one can either die, or if they don't die, their elderly parents or those that they live with underlying conditions will either die. So we have those two choices to make. Do you want to take this vaccine or intervention to protect yourself and those around you, or do you want just to live a free, a carefree life whereby you can get infection? You will either get severely infected or not, but you will make other people, become at greater risk. Do we need that? So let us, try to weigh those two things as we decide. But again, those informations or those rumors that people are spreading in markets, those are not coming from government agencies. And I'm also not speaking on behalf of any government agencies. I'm just making my own opinion from a scientific standpoint. As far as I know, those rumors have no kind of, there is no evidence to back those rumors. But of course, people have they have all the liberty to think the way they think. But of course, we also need to remind ourselves that there have to be limits, and we also have to think critically moving forward. Yes.
Absolutely. Thank you so much, Professor Edagwa, Benson Edagwa. Thank you for joining us at Africa Rise, where we want to keep bringing information and entertain, educate, and of course, be thought provoking on for people on the continent and in the diaspora. And of course, until Africa gets to the point where we're able to produce our own medicines and vaccines, then the trust issue will never go away. You will
Yeah.
agree with me, because
Yes.
when we were able to make vaccines on the continent produced by us, for our consumption, I think until we get to that point, the trust issues will never go away, because you can't blame us. We've been at the receiving end for a very long time for many, people who don't have good wishes. But we say thank you for coming, taking time out of your busy schedule to join us on this broadcast. And we say continue to do the good work you're doing. And we will call back to you again next time when we have issues that we believe that you're going to help us, clarify. Thank you so much.
Thank you so much, Susan, and everyone. Stay safe.
You too, Doctor. Okay, you've heard from Professor Benson Edagwa. I apologize on behalf of Dr. Paul Ohi. We tried to bring him on air. We tried and tried and tried, and I couldn't hear what he was saying. He couldn't hear half of the things I was saying. So I just thought there was no need, with the frustration of trying to get him on air. Thank you for joining us. Please share this broadcast. Please share the broadcast so that other people can see. There is always an information there for someone to take and run away with. So please share this information and keep a date with us again next Sunday, 5 p.m. I will, of course, broadcast who the next guest is going to be. And trust me, it's only going to get better. Thank you and God bless you. Bye-bye.